The first step in fitting the knee brace is preparing it to be fit. So firstly, you're going to want to push this button on the dial and bend the knee. That'll make sure there's no tension in the brace. Next, you're going to want to undo all the straps. In order to do that, you'll push these clips upward to open them up. Next, we'll do the fitting. First, you're going to have the patient standing, and go ahead and have them sit down. And I usually have patients scoot forward slightly so I can access the entire thigh. Next, I'm going to make sure that the brace is aligned well on the knee. So the first step is having the patient extend their leg to about 45 degrees, and then identify the condyles of the leg. That's going to be the boniest protrusion on either side of the knee. The boniest part, that's where the knee center should be. So then what I'm going to do is align the knee hinge with those bony protrusions to make sure the brace is sitting in the right spot. If it's too high, it's not going to bend really well with the leg. You also don't want it to be too low. So identify those locations and make sure that the pads right here on the knee are aligned with that. Next step is to make sure that these front straps are set correctly. So I'm going to have these loosened, push this down to the thigh, and then tighten. If I over tighten, it's actually going to pull the frame away from it and I won't be able to get all the way down. So push the frame down and tighten these front straps. Same thing for the bottom one. Push the frame down against the tibia and tighten the strap here. Next, after you do that, the most important strap on the back side is going to be the one on top of the calf. So that'll keep the brace from sliding down. So I'll loosen the strap, clip it all the way over on the other side. And go ahead and tighten the brace. Then I'll do the lowest strap, push the frame down, do the Velcro, and clip this on there, and tighten. You want to have these straps be nice and tight. Next, I'll do the same thing up at the top. So I'll do the strap just above the knee, push the frame down, hook this on, and tighten. And lastly, I'll do the one at the top. So after fitting the brace, there's a few things I like to check to make sure that the brace is fitting properly. The first of these is to make sure that these condyle pads on the knee brace are aligned with the knee center right here. The next thing I like to make sure is that these condyle pads are equally distanced away from the condyles of the knee, which all looks fine right here. Next, you want to make sure that there's no gapping between the brace frame and the actual leg. So up here by the thigh, which looks fine here, and same thing down here in front of the tibia. The last thing you want to make sure is make sure that these back straps aren't over tightened so you don't prevent circulation. And then also, if a patient is wearing pants, you want to make sure there isn't too much bunching. If there is bunching, you might want to refit the brace and first pull the pant leg down to make sure there isn't any bunching.